Hello and welcome to today's session. In today's session we're going to take a look at blood loss. Now blood is really important to us as it transports things around the body that our tissues and organs need. This includes oxygen, the nutrients to give us the energy, the white cells to help fight any infection, and plasma to help any wounds clot and heal. Now we've probably all cut ourselves, whether that's the little cut that just needs a plaster, or the graze that we think, oh, don't worry about it, that'll be all right. But actually, we need to think about grazes and the infection. They often get very dirty, we don't worry about it, and of course infection builds. So while it doesn't need much from a point of view controlling bleeding, we should ensure that we clean it up well and then stop that infection building down the line and then needing more treatment from a hospital. But what if we've got quite a serious bleed? Well, let's take a look at what we would do. Okay, so if we have a casualty that has a bleed to the arm and it's bleeding more than a plaster is going to deal with, our priorities are pressure and elevation. So if we were to have a casualty that's injured their arm, then we're going to take a look. I'm not yet touching the area that's bleeding, but I'm having a look and making sure nothing is embedded in there that's going to stop me putting pressure on. Having looked at it, I can get them to put pressure over the wound and I can get them to elevate it. I haven't yet got a first aid kit, but they are already doing their own treatment and looking after and controlling that bleed. At this point, I can get my first aid kit, I can glove up. So I'm going to get out my ambulance dressing in this case. So when you unroll it, watch you don't touch the pad because that's going on the wound. I have the short end of my dressing, I have the pad, and then I have the long end to carry on applying pressure. So I'm going to place the pad over the top of the wound. I can keep my casualty entertained by giving them the short end, keeps them distracted. I'm now sealing one end of the bandage, coming down, sealing the other end, stop anything from getting in and any infection. Now I'm using the rest of the bandage to apply pressure over the top. When I get to the end, I can then take this bandage, the short end, bring round, tie off on the top of the injury. Once I've tied, I can tuck in to the bandage on top, not the ends. I want a nice firm pressure to control the bleed, but not so tight that I notice the hands changing colour because I've cut off circulation. We can check circulation by squeezing the thumb for 5 seconds, letting go. You should notice it's pale, the colour then returns within 2 seconds. So squeeze for 5, release for 2. Okay, so that is looking at putting on our bandage. So you got to see a wound dressing being applied in practice, but with an arm you could go and put it in an elevation sling. Got the casualty sitting here, arms elevated, but I think they're going to get quite tired if they leave it in that position for a long period of time. So what you can ask them to do is just to lean the arm across the chest, it's in an elevated position, and we can utilise a triangular bandage. So with your triangular bandage you have the two ends and you have the length of the triangular bandage. You always want to remember length down the body. We also have the point, and we want the point to go to joint. So it's length down the body, point to joint. So I'm going to stand behind my casualty. You would always be standing in front to see if there's any changes, but you wouldn't be able to see if I did that. So the point is going to joint, and I'm following the line of the arm. But I only need a little bit to tie off, so I'm going to move the excess down the arm. So I've now got a small bit to tie off in the shoulder. We're going to just tuck that in underneath, bringing the bandage up behind, and I'm going to tie off in the shoulder. So watching that your sling does not slip out from underneath the arm, otherwise the arm will slide through. Is that providing enough support?
Yes.
Always check it's supporting. They might be holding their arm. If you don't ask, when you finish, they relax and the arm drops. Make sure it's nice and broad at the back. And then with the excess, you can either fold and then pin with your safety pin. I never have a spare safety pin in my back pocket, so I'm just going to take the triangular bandage, twist it tight and tuck it in. And there is your elevation sling, and you can now transport them to hospital while keeping it elevated and it's comfortable for them. So let's now see that in practice. Okay, so you've seen dealing with a wound in practice where there's been nothing embedded. But what happens if there's an object embedded? So as we approach to look at the arm, we can clearly see that something's sticking out of the arm. Now you do not pull it out. You don't know what angle it went in at. You don't know if it's blocking an artery and stopping severe bleeding. You don't know what damage you could do in pulling it out. So we leave it where it is. So we can't go and put direct pressure on it because we don't want to push it in deeper. But we do need to control the bleeding around it, and we also want to take the casualty's mind off it because they're not going to enjoy looking at something sticking out of their arm. So in this case we need to get something to pad round it. So I've got my 2 ambulance dressings here, so I can now go and put them either side, watching that I'm not pushing it in to the arm any further, and I'm putting them in the line of the arm, so following the line of the bones, to ensure an even pressure. So if my casualty can just gently hold those in place. So then I get my other ambulance dressing. If you didn't have lots of ambulance dressings, you could use other types of bandages or padding that covers the item. So in this case the padding is high enough to cover the nail, so I can put the bandage over the top. But if it was longer and sticking out further, I would put my pad out the way underneath. So I'm placing my pad over the top. If you want to hold on to that, again I'm distracting my casualty, utilising them to hold the short end. I'm going to go and seal one end. I'm going to go and seal the other. Now at this time I do not go applying pressure over the whole wound because I do not want to push the nail in. So I'm just continually sealing the ends, applying pressure on the ends so that it seals around it but not putting pressure on it. When I get to the end, using my ends, I'm going to tie off. This time I do not tie over the top, so I don't apply pressure, I'm just tying off to the side. and then I can just tuck any loose ends into the bandage at the top. No putting pressure on the item underneath, and then they can support it themselves. You may be able to put it in a sling, you may not, depends on where the injury is. So the key thing with this is you want padding either side. Put a bandage in place to hold your padding, but do not put pressure over the top. So let's see that in practice. So in today's session we've taken a look at blood loss. We've had a look at bandaging a wound to the arm, but you can apply that to any limb within the body. We've also looked at what to do if you've got an embedded object. So in the next session we're going to take a look at severe blood loss and what's the impact of losing a lot of blood. We're commonly known as shock. So next time, join us and find out how you support somebody who is suffering with shock as well as dealing with the bleed.